Imagine this for a moment. It is the second Wednesday of January 2026. You are 72 years old. You walk to the mailbox, open your bank statement, and see your Social Security deposit. But something is wrong. The number is smaller than you expected. You were promised a cost of living raise, a real raise. Yet your check looks almost the same as last month, maybe even less. Your hands begin to tremble. You sit down at the kitchen table and stare at the paper. You whisper, "Where did my raise go?" The answer is sitting right there in black and white. Medicare Part B just jumped to $202.90 a month. That is a $17.90 increase, the biggest in modern Medicare history. And it just ate 1/3 of your COLA raise. Add your Part D drug plan increase, and your raise disappeared completely. If that fear feels real to you right now, please don't go anywhere. Stay with me, because what I am about to share could protect your benefits, lower your premiums, and put hundreds, maybe thousands of dollars back into your pocket this year. I am Artur. I am a senior policy analyst, and I help retirees just like you understand the complicated rules that quietly drain retirement savings. Today, on Senior Pension and Benefits Hub, I am going to walk you through every key piece of the 2026 Medicare Part B premium increase. I will tell you who is protected, who is not, and the exact forms and programs the government does not advertise that can save you serious money. And please, stay until the very end, because there is one mistake I see seniors make every January that locks them into the wrong plan for an entire year and can cost them their dental, vision, and prescription benefits. I do not want that to happen to you or to anyone in your family. Let me tell you about Margaret. Margaret is 67 years old. She lives in Ohio. She retired in May of 2024 from her job as a senior accountant. She thought she was prepared for everything, but Margaret made 4 mistakes that she didn't see coming. First, in 2024, her last year of work, she earned $115,000. That number, 2 years later, in January 2026, triggered an IRMAA surcharge from the government. Her Medicare Part B premium suddenly was not $202.90, it was $284 per month, almost $1,000 a year more than she expected. Second, Margaret never heard of Form SSA-44. Nobody told her. So she didn't file the form that could have lowered her IRMAA charges based on her retirement. Third, she chose a Medicare Advantage plan back in October because of the dental and vision benefits. But when she opened her annual notice of change in September, she didn't read it carefully. She didn't realize that her dental allowance was cut in half and her over-the-counter benefit was eliminated entirely. And fourth, she missed the Medicare Advantage open enrollment window in January through March. By April, she was locked into the stripped-down plan for the rest of the year. Total cost of these mistakes? Just over $1,800 in extra premiums and lost benefits in 1 year. Margaret sat at her kitchen table looking at her Medicare statement and said softly, "If only somebody had explained this to me. I am explaining it to you. Right now. So please listen carefully. Here is exactly what is changing in 2026. The standard Medicare Part B premium is jumping from $185 a month to $202.90 a month. That is a $17.90 increase. The annual Part B deductible is also rising from $257 to $283. Both increases take effect on January 1st, 2026. Now please pay attention to this critical point. Most seniors will see the $17.90 increase pulled directly from their Social Security check. The 2026 cost of living adjustment is 2.8%. which raises the average retiree's Social Security benefit by about $56 a month. The Part B increase consumes nearly 1/3 of that raise. And if your Part D drug plan also goes up, which most do for 2026, your effective COLA could be 0 or even negative. But here is something most seniors don't know. There is a federal protection called the Hold Harmless provision written into the Social Security Act. This rule says that for most people who have Medicare premiums deducted directly from their Social Security check, the Part B premium increase cannot be larger than your COLA dollar increase. So you should never see your monthly check actually go down. But, and this is important, the Hold Harmless rule does not protect everyone. It does not protect new Medicare enrollees in 2026. It does not protect anyone paying IRMAA surcharges. It does not protect dual-eligible beneficiaries whose Part B is paid by Medicaid. And it does not protect anyone who pays their Medicare premium directly instead of through Social Security. That means roughly 30% of all Medicare beneficiaries, around 20 million seniors, will pay the full $1,790 increase with no cap. If you are one of them, please listen carefully to the next part of this video. Now let me explain IRMAA. This is where the biggest sticker shock happens for retirees with higher incomes. IRMAA stands for Income-Related Monthly Adjustment Amount. It is an extra fee on top of your standard Part B premium that kicks in if your income is above certain levels. Here is the trap. The income they look at is from your tax return 2 years ago. So your 2026 IRMAA is based on your 2024 income. Here are the 2026 IRMAA brackets for single filers and married couples filing jointly. If your modified adjusted gross income is $109,000 or less for singles, or $218,000 or less for couples, you pay the standard $202.90. Above $109,000 for singles or $218,000 for couples, your premium jumps to $284 a month. It rises in tiers from there. At the very top bracket, single filers earning $500,000 or more, or couples earning $750,000 or more, pay $689 per month per person. That's $1,378 a month for a couple, over $16,500 a year, just for Medicare Part B. Now please pay close attention. If you had a one-time income spike in 2024, maybe from selling your home, doing a Roth conversion, taking a big retirement distribution, or finishing your last year of work at a high salary, you may get hit with IRMAA in 2026, even though your current income is much lower. Here is your protection. It is called Form SSA-44. The Social Security Administration accepts a request to lower your IRMAA if you experienced one of 8 qualifying life-changing events: marriage, divorce, death of a spouse, work stoppage, meaning retirement, work reduction, loss of income-producing property, loss of pension income, or an employer settlement payment. Most seniors have never heard of Form SSA-44. They overpay IRMAA for an entire year, sometimes thousands of dollars, when they could have filed a simple form and gotten the surcharge reduced. Now let me explain the Part B late enrollment penalty. This one is brutal because it lasts forever. If you delay enrolling in Medicare Part B past your initial enrollment period without qualifying employer coverage, the government adds a 10% penalty for every full 12-month period you waited, and this penalty is added to your premium for the rest of your life. A 5-year delay is a 50% surcharge forever. At 2026 rates, that's $304.35 a month, costing more than $24,000 over 20 years. Now please listen carefully, because this is the hidden mistake I promised to share. It is missing the Medicare Advantage open enrollment period. Here is what's happening in 2026. Many Medicare Advantage plans, those plans seniors love because they offer dental, vision, hearing aid coverage, gym memberships, and over-the-counter allowances, are dramatically cutting those benefits this year. OTC allowances are being eliminated. Dental and vision allowances are being slashed. Transportation rides are gone. Gym memberships are reduced or eliminated entirely. The annual Notice of Change letter, sent to your home every September, explained all of these cuts. But many seniors did not read it carefully and missed the December 7th enrollment deadline. Here is the protection most seniors don't know about. From January 1st through March 31, 2026, there is a Medicare Advantage open enrollment period. During this window, you can switch to a different Medicare Advantage plan, or you can drop Medicare Advantage entirely and return to original Medicare with a Part D drug plan. But please pay attention. If you switch back to original Medicare, you may need to apply for a Medigap supplemental policy. And Medigap insurers can require medical underwriting in most states, which means they can deny you coverage for pre-existing conditions. Some states have guaranteed issue protections, but most do not. This single window, January through March, is your one chance to fix a Medicare Advantage choice you regret. Now let me give you 3 exact actions to take. Right now. This week. Step 1. Open a My Social Security account at SSA.gov.my account. Verify your January 2026 deposit amount. Verify your Part B premium. If you are paying more than $202.90 a month, find out why. It is either an IRMAA surcharge or a late enrollment penalty. Both have potential solutions. Step 2. If your income was high in 2024 because of a home sale, retirement bonus, or any one-time event, but your income today is lower, download Form SSA-44 directly from ssa.gov. Forms SSA-44 PDF. Fill it out, gather documentation of your life-changing event, and submit it to your local Social Security office. This single form can save you thousands of dollars in 2026. Step 3. If your income is modest, please apply for a Medicare Savings Program through your state Medicaid office. The QMB, SLMB, and QI programs can pay your entire $290 Part B premium for you. Millions of eligible seniors do not apply because they don't know these programs exist. The full Part B premium for 2026 is between $434 or $80 a year. That money could be back in your pocket. And if you are a Medicare Advantage member who just realized your benefits were cut, please review your plan immediately. Use the Medicare Advantage open enrollment period from January 1st through March 31 to either switch plans or return to original Medicare. After March 31, you are locked in for the entire year. Now please listen to me carefully. Everything I have shared with you today comes directly from the Centers for Medicare and Medicaid Services, from Medicare.gov, from the Social Security Administration, and from AARP. These are not opinions. These are the official 2026 numbers and rules. But here is the painful truth. Medicare will not call you to remind you about IRMAA appeals. The Social Security Administration will not warn you about Medicare Savings Programs. Insurance companies will not point out the open enrollment window that lets you escape their stripped-down plans. And nobody is going to knock on your door and explain Form SSA-44 to you. You have to protect yourself, and you cannot rely only on YouTube notifications. The algorithm changes constantly. Important videos that could save you thousands may never reach your screen. So please, do this for me. And more importantly, do it for yourself. Click the link in the description below to join the Global Senior Alerts official WhatsApp channel. When you join, you'll be able to download the free Senior Benefits Protection Guide, and you'll receive real-time alerts about Social Security changes, pension rules, banking regulations, insurance policies, and travel rules that affect seniors. It is completely free, and it could save you thousands. Bookmark Medicare.gov, bookmark SSA.gov, bookmark ARP.org. Check these official sources at least once every season. Share this video with someone you love, a spouse, a sibling, a friend at church, a neighbor on Medicare, because the family that knows the rules keeps their money, and the family that does not loses it to premium hikes and benefit cuts they never saw coming. Subscribe to Senior Pension and Benefits Hub, hit the notification bell, and stay with me, because next week I am going to reveal another quiet rule that affects every senior in America. You work too hard, for too long, to lose your benefits to rules nobody explained. Stay informed, stay protected, and I will see you in the next one. This is Artur. Take care of yourself and take care of each other.